Hi everyone, I'm Sierra Bailey, and this is a project addressing the drug epidemic in Butler County. I'm just going to get right into this because every time I try to record it, it ends up being very long. And I understand you guys are professionals who have lives, and you don't want to listen to this all day long. So, the drug epidemic became a huge issue to me in high school when I was on a run in Oxford. I was outside of the campus where often there are a lot of families with young children and a lot of elderly people walk their dogs. I would consider it a really safe area. And it was about a Sunday afternoon, beautiful day. I came across a discarded heroin needle. And it resonated deeply with me and really affected me because what would happen if a child came across that? And that was kind of the turning point for my mind to realize that it's happening here. So, as lawmakers, law enforcers, or just citizens of the community, being aware and addressing the drug epidemic it's important. Drugs are illegal because they often harm users and the community. There's statutes in Ohio regarding drug abuse, but it's still happening. I found data on the Butler County Health Department website. 4 members on December 4th of the Butler County community went to the hospital for a drug-related overdose. That's 4 mothers, daughters, fathers, sons. This drug issue is happening in every state. It's not just limited to Ohio. And it's affecting everyone. You have pop culture like celebrities like Mac Miller overdosing. You have unemployed or homeless populations that you may never hear about. Butler County specifically has a surplus of overdose. This data was collected by InsightLiveStories.com, and it's basically just a graph showing the overdose dispatches, hospital visits, or deaths from Butler County and the surrounding areas. And as you can see, it's astronomically larger in Butler County than in Claremont or Hamilton. And as I mentioned, the statutes and the laws are in place to protect the community. Whether this is the user, their family, the community entirely. And the punishment for opioid abuse is severe. Yet the numbers of overdoses and arrests are not lowering. As you saw in the previous slide, people are overdosing every day. And I have here the drug abuse statute and the drug controlled substance statute from the Ohio Revised Code. And the drug abuse explains, how it's illegal and felonious, and the drug controlled substance explains more of your prescription opioid abuse, which I'll get into later. If you'd like more information, it can be found at codes.ohio.gov or the Ohio Revised Code. And this is what all of your law enforcement officers are versed in, your lawyers, your judges. This is every statute for Ohio. If you get arrested for something, it's from the Ohio Revised Code. And according to the Butler County Department of Health, opioids are a class of drug that bind to certain receptors of the brain. They can be illegal street drugs or prescription drugs that are misused or diverted. And examples of this is heroin, fentanyl, carfentanil. And as I was conducting research for this project, I came across so many demographics affected by this, and how oftentimes, painkillers are prescribed to people seeking health care, inevitably leading to addiction. And this really addresses how and why this became such an epidemic. It's a major problem because heroin and opioids are accessible, highly addictive, and often lethal. It's easy to access, it's cheap, it's appealing, and it's hard to stop. According to the International Journal of Drug Policy, it's ironic that heroin, one of the few drugs entirely prohibited under the U.S. drug control laws, remains so widely available and relatively inexpensive that even those opioid-dependent users who are reluctant at first to try it are ultimately persuaded by market forces when their pill of choice becomes unavailable or unaffordable. These pill initiates, for the most part, did not seek out heroin, and in fact, oftentimes they stigmatized it. So you're looking at abusers who are not who you'd think they would be. These are oftentimes, as I'll mention in the next slide, higher demographics, higher class of people. It's not just lower class people affected. And Andrew Knus mentioned in his article, The Epidemic of Prescription Opioid Abuse, the subsequent rising prevalence of heroin use and the federal response, that heroin is less expensive than the prescription opioids. So, depending on your location, the prescription opioids may cost approximately $8 to $10 per milligram, where an entire bag of heroin, which could be 50 milligram, will cost $9 to $10. And this article ties into that because it is explaining how in Ohio there's a variety of demographic classes being affected and using heroin, and the use is different depending on the classes. So, you have your higher class doing what is called prescription opioid poisoning, which is the typically more expensive opioid abuse, and then heroin, the cheaper alternative, is what your lower class demographic is using, but it's doing the same thing. It's affecting the whole community. Knowing is understanding. Heroin is a large contributor to overdoses in Butler County. And here I have the Center for Disease Control and Prevention's definition for heroin, and a statistic that I found incredibly alarming. In 2017, 494,000 people in the United States reported using heroin in the past year. If this many people disclosed information, how many did not? Here I have a visual from the University of Wisconsin Population Health Institute County Health Rankings. They rank all the drug overdose deaths, and here they have 88 counties of Ohio listed, and I have just a select few screenshot here, but I think it's all you need to see. You have Athens with 26 drug overdose deaths. You have Clark County with 251, Ashland with 29, Butler County 686 drug overdose deaths from the year 2015 to 17. For any more information, I'll have the Wisconsin Health Institute source cited at the end of this. That's a remarkable number. That's alarming. The epidemic, it's not only affecting users, but children, families, and first responders too. The number one cause of crime in Ohio is opioid addiction and related offenses committed to pay for drugs. An estimated 200,000 Ohioans are suffering from addiction, and at nearly double the national average, Ohio has one of the highest rates of overdose deaths in the country. This was a quote from Senator Rob Portman disclosed by the Highland County Press in 2019. This is a video from Let's Face Heroin in ButlerCounty.org.
Heroin. It's seeping through our communities, into our cities, and into our suburbs, and our schools, our jobs, and even our homes. If you don't already know somebody affected by heroin, chances are you will. Right here in Butler County, nearly half of all deaths investigated this year have been related to heroin, and 46% of all people being treated in Butler County for substance abuse use heroin. Prescription opiate painkillers often become a gateway into heroin. Users get hooked, and once they do, heroin is cheaper and easier to get. Injecting, snorting, smoking, the high is easy, as is the grip of addiction. Heroin destroys the lives of users, their families, and our communities. It strikes everywhere. In your neighborhood and mine. It affects us all. Rich and poor, white collar and blue, young and old, men and women. Let's face it,
With statistics being so high in such a small constituted area, it's no question that this is a complex problem that affects many people. It affects first responders, the medical, people trying to save your life, the community, children, and the video mentioned that if you don't already know someone that's been affected, you probably will. I hope this presentation has left you with an understanding of just how prevalent and severe the opioid crisis is in our community. And I hope that you treat this problem with compassion. As I've covered in this presentation, those addicted or affected by the epidemic may not be who you expect. So be kind to everyone, and let's help the community heal. As lawmakers, understand that treating this problem will require more than just statutes and incarceration. And at the very minimum, just being aware of the problem is a step to combating it. Thank you.